In this lecture, we'll talk about acne. Before we start, I want to bring an important update to your attention, and this update is the change to the name of the bacteria that causes acne. So we all know the name to be Propionibacterium acnes, and now Cotibacterium acnes is the new name. So during this lecture, if you find that there is any reference to the bacteria as Propionibacterium acnes, it should be the new name Cotibacterium acnes. So our first question is about the underlying abnormality. And the question is the underlying abnormality in development of acne is believed to be, and the answer for this question is A. So increased androgen effect or activity is believed to be the underlying abnormality in acne. The four abnormalities listed on this slide will take place in order. On the next slide, we'll talk a little bit more about the development of acne in details, because we will need these details in order to understand the treatment. So acne is a disease of hair follicle. The disease usually starts around the puberty time due to the release of excess amount of the sex hormones. What the sex hormone does is it stimulates the sebaceous gland, leading to increased sebum production. So there is more sebum produced by the sebaceous gland, and the sebaceous gland is this little gland on the side. The sex hormones will also cause the cells lining the hair follicle to divide rapidly, and this what causes over-keratinization. So there are lots of cells. These cells move outward, and these cells will block the pore of the hair follicle. So when it blocks the pore of the hair follicle, the sebum in the sebaceous gland, the sebum produced by the sebaceous gland, will get trapped in the hair follicle. So what we have right now, we have a plug made of dead skin cells. These dead skin cells are coming from the lining cells of the hair follicle that are dividing rapidly because of the sex hormones. Plus, we have excessive sebum that's trapped in the hair follicle because of this plug that we have. Typically, this what we call comedone. So the comedone is a blocked hair follicle with sebum trapped in it. Now, there are two different types of comedones. There is what we call open comedone, or also what we call the blackhead. In the open comedone, the sebum accumulated in the sebaceous gland push the walls of the hair follicle and forces the pore on the surface of the skin to become dilated and open. So here, if you see, you will see that the pore of the hair follicle gets really dilated because of the trapped sebum. So the sebum push the walls to the side and force the pore of the hair follicle open. So the sebum in the hair follicle now gets exposed to the air because it's on the surface, and it gets oxidized and it turns black. And that's why we call the open comedone the blackhead. Sometimes the comedone is closed. In the closed comedone, the pore of the hair follicle, as you can see here, little tiny pore, the pore of the hair follicle doesn't get dilated, and instead the sebum forms a white dome-shaped papule at the tip of the pore. So there will be light you can see here in the picture. This is a white head, or what we call closed comedone. Here is the black head, or what we call open comedone. So actually, you will find that the pore of the hair follicle is dilated because the sebum is pushing the wall of the hair follicle outward, forcing the little pore to be open. Okay, now at this point there is no inflammation. So far, comedones are not inflamed. It's just accumulation of the sebum in the hair follicle, and it's blocked. And again, it can be black or white, blocked or open. Now let's talk about the role of Propionibacterium acnes, the bacteria. So the Propionibacterium acnes is gram-positive bacilli that lives normally on the skin, and actually it lives specifically in the hair follicle. And its main job is to digest the sebum. So Propionibacterium acnes digest sebum. When Propionibacterium acnes digest the sebum, um, as a result of the digestion, Propionibacterium acnes will release free fatty acids. One of the byproducts of the sebum digestion is free fatty acids. These free fatty acids cause irritation and inflammation of the hair follicle, and it causes inflammatory acne. Rupture of the pimple also, if the pimple ruptures, this will release the fatty acids, and releasing the fatty acids will irritate and will cause other hair follicles in the area to get irritated and will lead to the production of more formation of more comedones. So again, rupture of the comedone or rupture of the pimple will release the free fatty acids in that pimple to the surrounding area, and these free fatty acids will cause the area around the pimple to get irritated and to have more comedones. This may explain why it's important to advise the patient to not squeeze the pimples, because this leads to the spreading of the fatty acids to the adjacent area and the